Hey everybody, welcome to lab number 10. Lab number 10, the second lab on the skull. Last time, we did lab number 9. We did the cranial bones of the skull. Now this time we are going to do the facial bones. So last time we did the cranial bones, this time we did the facial bones. Let's run through the cranial bones really quickly, just in case you forgot any of them. This guy right up here is of course the frontal bone. We see him right here as well. He is going to articulate with the two parietal bones behind him with that good old coronal suture. Frontal bone also articulates with this very nice greater wing of the sphenoid bone right here. And the greater wing of the sphenoid and the parietal are going to hit and form a joint with the temporal bone right here. In particular, the squamous part of it. And we see that squamous suture right there. We see our occipital bone back here. And we see that lambdoidal suture between occipital and parietal. We also saw the ethmoid bone hiding in the orbit. There's its orbital plate right there. And in the nasal cavity, we see it right there with its perpendicular plate and with the middle nasal concha. So those are the bones we did last time. I know I didn't go through every little part like we did previously because that would just be a whole nother long video. But today we're doing facial bones. So if you remember from last time, the cranial bones were the part of the skull that formed the cranial cavity. So the facial bones are the rest of the skull, the part of the skull that's not forming the cranial cavity. And let's see if we can introduce ourselves to some of them. In the very front right here, we are going to see the jawbone. Whoops, I should probably turn my pen on. There we are. We're going to see the jawbone or the mandible right there. Nice, beautiful mandible. That's the lower jawbone. And we see that mandible over here in the side view as well. We also see the upper jawbone, which is the maxillary bone. We got one of those on each side. So we see those maxillary bones there. We can see them on this side as well. We also see the two cheekbones, the zygomatic bones. We see it in the lateral view and the front view. We see both of them. If we look in the orbit, we are going to see the lacrimal bone just behind the top superior part of the maxillary bone there. We're also going to see the nasal bone on the bridge of that nose. We can see that beautifully in both sides. We are going to see the vomer forming the lower portion of the nasal septum. And just lateral to it on each side, we are going to see this lower bulge right here on both sides. Each of those lower bulges is an inferior nasal concha. So those are all the facial bones that we can see in these views. So we've got a little bit of an introduction to them. Let's now look at each one individually and check them out. So we are starting with the mandible. Here we have a nice model of the mandible. A lot of nice teeth in there. And this central kind of U-shaped part here is the body of the mandible. Biggest part is the body of the mandible. So your chin is in the body of your mandible. If you walk back, if you grab your chin, you kind of walk back until your mandible takes an upward turn. That's where the body stops. So we got the body of the mandible. We see the teeth anchored to it. In fact, there is a sticky up ridge where the teeth are. So this whole sticky up ridge that I'm tracing a black line on, and let me redo that line because I didn't mean to take it over into that tooth. This whole sticky up ridge right here, it wraps all the way around. We can see it on the inside as well. That whole sticky up ridge is called the alveolar process of the mandible. It is the word alveolar is used because the word alveolar refers to the little sockets. They're little U-shaped sockets that the teeth are going to sit in. There we go. So We can see that alveolar process. What else can we see in this mandible? Well, just lateral to the chin, to the front part of the chin, we see a little hole right there. That little hole is called the mental foramen. Now you might look at that word mental and your immediate thought would be, oh, brain thinking. Well, the word mental anatomically refers to the chin. So your chin is technically your mental region, and this hole just on the lateral chin here is the mental foramen. There's going to be a nerve called the inferior alveolar nerve, which slips through it. It's going to take sensory info from your lower teeth as well as your lip and your chin. If you've ever had a cavity filled in one of these lower teeth, if you've ever gotten these teeth numbed, you're definitely feeling the numbness in all of these parts because you are paralyzing that inferior alveolar nerve for a little bit. Okay, what else can we see on this mandible? All right, when the body starts going upward, so I'm going to write the word body on the body here. So this is the body. And the body right here starts an upward stretch. And this upward stretch is called the ramus of the mandible. The word ramus means branch. It's kind of a flattish branch that extends from the body. And it's doing it on each side. We can see another ramus over here. Now coming off that ramus, we're going to see some things. We're also going to notice that there is a definite obtuse angle here that we can see. So when the body, so here's the body right here, when the body makes that turn to become the ramus, that spot right there that I'm coloring in is called the angle of the mandible. It's a good landmark. It's used in dentistry and orthodontia and other related fields like that. All right, but what about those rami? What's coming off of them? Well, we have two processes. There's one in the front. There's one in the front. There we go. One in the front and one in the back. The posterior one is called the condylar process. Now, if you remember that word condylar, we saw occipital condyles at the base of the skull. They allowed you to make that nodding motion. We have a similar rounded structure here. That's why it's called a condyle. It's rounded. Remember, the word condyle means it looks like a knuckle. So this mandibular condyle is this rounded guy. And we got another one over here. Each mandibular condyle is going to articulate with the dent in the temporal bone. And if you remember, that dent is called the mandibular fossa. And when those two unite, we form that temporomandibular joint. We have one of these on each side. Okay, so that's the posterior process there. And there's an anterior one as well. It is definitely skinnier. It doesn't have that same nice round joint surface. And this guy right here is the coronoid process. This one is for muscle attachment. If you think about clenching your jaw, so there's actually muscles from the side of your skull that come down and grab onto this and pull it up. So the coronoid process of the mandible is where jaw muscles attach. And with that, we are done with the mandible. So now we are going to move on to the maxillary bone. And we saw the maxillary bone earlier when we were just introducing ourselves to it. Here is the maxillary bone. It actually has a lot of parts to it. It goes up pretty high right there. Comes on down like this, comes back over, comes around. Very lovely bone, even back here as well. There we go. The maxillary bone being right in the middle like that, it articulates with a bunch of other bones. I mean, you can see it's hitting the zygomatic. It's hitting the lacrimal, the green guy right there. It's hitting the nasal, the inferior nasal concha, the ethmoid, the vomer. Can't see it, but it's hitting a bone called the palatine bone as well. It's hitting the frontal bone too. So it is definitely articulating with a lot of bones. We can see that right here. Now, the maxillary bone is going to have some important structures. It also has the last sinus that we're going to look at. So if we do a frontal section of the skull, we can see the cavities here, and we can also see the sinuses. So we got a frontal section we're doing here. We can see the oral cavity down here. We can see the nasal cavity, both sides of it right there. We can see the orbit on each side here. And the cranial cavity is up here. Now we can also see some sinuses here as well. We can see let's do a different color here. We can see the ethmoid sinus right here. We can see the sphenoid sinus right here. And this really big sinus right here is one of the two maxillary sinuses. So there's one on each side. Really big mucus production factory right there. All right. Let's find some more stuff on that maxillary bone. If we look just beneath the eye socket, we see this little hole right here. That little hole right here is called the infraorbital foramen. Infraorbital, beneath the eye. So it's infraorbital foramen because it's a hole. It's a passageway. You're going to get nerves. You got nerves going to the upper lip, the lower eyelid. You got blood vessels. There's an artery that flows through there that goes to stuff around the eye, so periocular things. Goes to your upper teeth as well. There's also a vein that runs through there that drains the floor of your orbital cavity. So all important things running through that little passageway. Okay, almost done with the maxillary bone here, or the maxilla, whichever one you want to use is fine. Now it has teeth, right? It's got teeth. The mandible had teeth. There are sockets for the teeth. So the mandible had a sticky out ridge with those sockets. The mandible had that sticky out ridge called the alveolar process. So it stands to reason, logically, there is going to be an alveolar process for the two maxillary bones as well. So each maxillary bone is also going to have an alveolar process with its own alveoli or sockets for the teeth. All right. And with that, we only have one little part of the maxillary bone left to do. And so what I got here is an inferior view of the skull. If I see all these teeth right here, all these nice teeth on the two maxillary bones, and just within that upside down U of teeth that I see here, we have this whole region here, which I'm going to outline in red. This whole region is called the hard palate. It is the bony part of the roof of your mouth. Behind it, not visible, but right here where my mouse is dancing, there would be your soft palate, which is a more muscular structure. But this is the hard palate right here. Now the hard palate is actually made up of 4 bones. There is a maxilla in the front on each side, so that's 2. Then a palatine bone in the back on each side. And we'll deal with the palatine bone in a moment, but right now we're worried about the maxillary bone. And right here, we've got, I'll circle both of them. These are the 2 horizontal plates. Whoops, I didn't mean to say horizontal plates. I meant to say palatine processes. I'm getting ahead of myself. I'm jumping on to the next bone already. Thinking about what I'm going to talk about next and actually saying it. So each of those things is a palatine process of the maxillary bone. Now, I want you to notice the suture right here. The suture right here running between the 2 pairs of bones is called the median, because it's in the middle. The median palatine, yeah, that says palatine, suture, the median palatine suture. All right, let's look again at these guys, and we'll bring in the palatine bone as well. So let's go ahead and do that. So here I got my skull model, and I can totally see this part right here. Dun, dun, dun. This part right here is the palatine process of the maxilla. The two of them, the left and right sides, are going to form basically the front 75%, the interior 3/4 of the hard palate, which of course separates your nasal cavity from your oral cavity, which is crucial to do. Okay. If we look posterior to that maxillary bone, so notice we had a maxillary bone right here, two maxillary bones. Posterior to it, we see our two palatine bones right here, also forming part of the hard palate. Now, each palatine bone is shaped kind of like a fancy capital L, like a calligraphy L. And what we're seeing in this view, we are looking in this direction. We're looking at this part of it right here. This other part right here that we don't see in this view is going to form part of the nasal cavity. It's going to form part of the nasal cavity, like the lateral wall of it. Okay, so let's look at our skull model a bit. Here we see the bottom of the palatine bone. This chunk right here is called the horizontal plate of the palatine bone. And we have one on each side very nicely. These guys forming the posterior quarter, maybe even a little bit less in this one, of that hard palate. Now, notice that median palatine suture, which we see running all the way right here. Now, I just want to reiterate, in this view, we are just seeing a little chunk of the palatine bone. Remember, the palatine bone actually goes up as well. So in this view right here, the oral cavity would be down here. The nasal cavity would be right here. The orbital cavity is actually up here. So the palatine bone is going to hit 1, 2, 3 cavities. All right. We are moving right along. We are flying along, which is fantastic. Okay, now we're going to do 3 bones I think are fairly quick and easy because there's not a lot of parts to them. We are going to do the inferior nasal concha, which I see right here. So, and we got that guy on both sides. And we actually met him last time as well. We are also going to do the lacrimal bone, which we can see right in here. So we're going to do those 2 bones. We are also going to do the nasal bone. Whoops, I meant to draw on that nasal bone, which we see the nasal bone right here and right here. So let's go through these 3 bones. So starting with the inferior nasal concha, we got to remember the ethmoid bone had 2 bulges on each side, and these bulges in the nose are called nasal conchae. We can see one of the ethmoid bone's nasal conchae right here. That is one of the middle nasal conchae of the ethmoid bone. And there's also a superior nasal conchae on each side up here. We just can't see it. What we can see is a separate bone right here. This is a separate bone. This is the inferior nasal concha. Okay? So articulating with your palatine and your maxillary, helping to form that lateral wall of the nasal cavity. It is going to bulge. And the fact that it bulges gives us more surface area. More surface area, remember, means more mucus. More mucus means we're better able to modify, in other words, filter, warm, and humidify the air that we breathe in. So hey, that's it for the pair of inferior nasal conchae. We are now zooming in on the orbit. So here's the frontal bone up here. This whole stretch right here is the orbital cavity. So I'm zooming in on that orbit. Go back and look at the big skeleton picture if you need to. Big skeleton, big skull picture. That's what I meant to say. And right next to our nasal bone, so there's our maxillary bone. Can I change that N into an M? There we go. Right next to our maxillary bone, we have this little rectangle right here. This little rectangle right behind the maxillary, right in front of the ethmoid. That little rectangle right there is the lacrimal bone. Lacrimal means tears, basically, okay? And this is going to make sense because there is a hole for tears right here. There's a passageway called the lacrimal fossa. There's a structure in there called the lacrimal sac, which is basically like the first place tears are going to flow. They're going to go down this nasolacrimal duct to drain into the nasal cavity. So, nice little rectangular lacrimal bone. We see it just behind the maxillary, just below the frontal, and just in front of the ethmoid. So hey, like I said, that one was quick too. Quick and easy. Now we got the nasal bones. Super easy. These bones are going to hold up your glasses. One on the right, right there. Another one on the left, right there. Articulating with the frontal bone up top and the maxillary bone just right next to them. They are the bridge of your nose. So hey, that one was done too. That one was pretty quick. What's next? I think we're going to do the zygomatic bone next. So we see the zygomatic bone, the cheekbone on each side, helping to form that lateral orbit. We see how it comes up right here and helps form that lateral orbit wall right there, which is pretty important. We see it coming back and meeting the temporal bone right here. So let's look at the model of the skull. All right, when we look at the model of the skull here, we got the side view of that zygomatic bone. We see it going up to meet the frontal bone. We see it coming back to meet the temporal bone. Now you only have to know one chunk of the zygomatic bone, which is this part right here, which I am shading in red, sort of. That part right there is called the temporal process of the zygomatic bone. So it is the part that meets, that articulates with the temporal bone. That's why it's called the temporal process. So the zygomatic bone has a temporal process, and the temporal process has a, and the temporal bone, sorry, has a zygomatic process. Fantastic. All right. We are so close to being done. We actually, I think, only have one more facial bone, then a few special weird bones to do. And this next facial bone is the vomer. It's the vomer. This is a bone by himself, so unpaired. It's going to form the bottom of the nasal septum. So if I put a little dot right there, below that red dot, which I will put a black line on, that is the vomer right there. The bottom of the nasal septum. The upper part of the nasal septum we met last time was the perpendicular plate of the ethmoid bone. And because the vomer comes down and it's going to sit on that hard palate, it is going to articulate with your palatine bones and your maxillae. All right. Yeah, that one was pretty quick too, wasn't it? That's not bad at all. We see the vomer from the backside as well. And what's kind of cool here is when we see the vomer right here, we can see the two posterior passageways for the nasal cavity. So if you find those two back of the nose holes, in between them is the vomer. And remember from last time, on the outside of those nose holes, we have these processes right here, which were the pterygoid processes of the sphenoid bone. I feel like it looks kind of like an elephant, what I just drew right there. Don't know if you agree or not. All right. So we are so close to being done. We got to do 4 weird bones now. And these aren't really weird. These guys are just tiny. These are the 3 auditory ossicles. These are the bones that are in your middle ear cavity. They're actually in the petrous part of your temporal bone. When sound waves go through your external acoustic meatus, so your ear hole, they hit your eardrum, your tympanic membrane, they shake it. It's going to shake the malleus, which is then going to shake the incus, which is then going to shake the stapes, which then shakes inner ear stuff, which creates nerve signals, which tells your brain, and you interpret those sounds that you hear. Pretty amazing set of machinery. Tiny bones here, smaller than a dime, 3 of them in each ear. We know that's one of the things that makes us mammals, that we have these 3 middle ear bones on each side. So those guys are pretty cool. They're also, by the way, they're done growing and developing by the time you're 1 year old. So they're like the first bones to finish growth. So it's like you've got the same size from your 1 onward, from your 1 until you're 99. All right. So close to being done. We have one more bone, which isn't even a skull bone, but we do it with the skull section because it's like, hey, we don't know where to put it. It's a weird bone. It's called the hyoid bone. The word hyoid refers to a Greek letter like upsilon, which looks kind of like that. Something like a fancy Y. And someone thought it kind of looked like that. Maybe. This bone is going to sit just above your larynx. So if you find your Adam's apple, you go up above it, you can find this bone. You can actually palpate it. Just don't palpate it too hard. It is a crazy bone in that it forms no joints, no articulations. It doesn't attach to any other bones. No, it does attach to the cartilage of the larynx, and it does attach to a lot of tongue and neck muscles. So it's not like it's floating in there or anything. But with that, folks, we are done with lab number 10, which was just an amazingly short lab. I know lab number 9 was ridiculously long. Lab number 10, blissfully short. So, good stuff. I will see you guys next time.